Good morning, guys. You know the weird thing, today doesn't even feel like a Monday because I feel like I've been doing work this entire weekend. Like both Saturday and Sunday I was at school very early in the morning, so today feels like a Wednesday or Thursday. Kind of lose track of weekends in med school, to be honest. You're working 7 days a week. Hey guys, long day at the office. We have a lot of patients to talk about. First patient, 81 years old, long history of COPD. She came in and did a spirometry test. Your FVC1 is supposed to be 80%. 80% means you're good, no obstruction, everything is fine. Hers is 39%, guys. That is really not good. As a way to figure out why her reading is so bad, the doctor did a little investigation, I guess you can say, and asked her how she's taking her meds. And she had it in her bag, so she demonstrated how she takes the meds, and it's completely wrong. She has a Symbicort inhaler. So I'm not sure how many of you guys actually know how to use an inhaler, but essentially you're supposed to breathe in the medication. So you breathe out, completely empty your lungs, put the inhaler in your mouth, spray the medication, and then breathe in. So you're really like breathing in the medication into your lungs. The point is to get it all the way down there into your chest, right? And then hold it. A lot of what she was doing, like all the medication was stuck in her mouth to the point that you would see the medication being breathed out when she would open her mouth. So she was using it like a cigarette, like really quickly. And no, that's not the point. You're supposed to and then hold it in your chest, count to like 10 seconds or something, and then breathe out. When she comes back for the follow-up with the proper uses of the medication, we'll see if that made the difference. Okay, next case is a 61-year-old black Hispanic man. I think he's from Dominican Republic. He has left ventricular hypertrophy. His cardiologist did an ECG, so we have a copy of it. I don't have a physical copy. Sorry guys, I can't show it to you, but there was left axis deviation, there were inverted T waves, and there was hypertrophy seen on the ECG. And he has not changed his diet. He's not exercising. His blood pressure on his last checkup was 170 over 110. Today it was 130 over 100. So the doctor is considering giving him an additional medication. So the question was whether to give him calcium channel blockers or an ACE inhibitor. Honestly, either could work and both have side effects. So it's like, that's a tough choice about being a doctor, I guess, which one to prescribe, because you would see improvements from both. It's just which side effects would affect the patient more. Also, which side effects are really vast. You know what I mean? Like with calcium channel blockers, you can have peripheral edema, but that is not as common. And with ACE inhibitors, you can have the dry cough. So you really have to consider the pros and cons about giving these meds. We ended up giving him an ACE inhibitor. I think it's because he's pre-diabetic, so we want to have that preventative protection of the kidneys while also bringing down the blood pressure. But in addition to this medication, he has to change his diet, not only for the blood pressure, but because he's pre-diabetic, he needs to pay attention to that. Additionally, exercise. But the thing is, the tricky thing with left ventricular hypertrophy or any sort of hypertrophy is you can't really exercise too much or too high intensity of exercise because the heart is already trying its hardest to keep you alive. So you can't do anything like basketball. You know what I mean? You can do weights, you can walk on a treadmill, not run on a treadmill. You know what I mean? Like exercise, but not too much to hurt your heart. It's tricky. Hey guys, I had to split this video into two different recordings because laziness. Okay, so patient number 3, I think, or 4. Anyway, a patient with chronic COPD. So remember we had the previous patient with her FEV1 of, hang on, her FEV1 of 39%, right? That is really not good. This other patient was 83, and her FEV1 was, sorry, this one isn't highlighted, but 35%. So the first patient was with the 39% was using her inhaler incorrectly. This patient, we had to change the medication. So we ended up giving her Symbicort and Spirivia. Man, it must be really challenging to be that old and have to take so many medications. So the 2 inhalers we gave her were color-coded, which is really good. So the Symbicort was red, and she has to take red twice a day, morning, evening. The Spirivia was blue 1 time a day. So I really hope that helps. Man, she lives alone, 83 years old, and it's like, I really hope these people can handle this. You know what I mean? Additionally, she had some blood work done on her last visit and it came back and we reviewed it. Her A1C number, the number you check for diabetes, went down, which is really good. It's 6.9 now and it was previously 7.3, I believe. She also did a urine test and there were increased leukocytes and nitrates. If you guys know what that means, she had a urinary tract infection. Really, really interesting. 83 years old. So we prescribed ciprofloxacin both for the UTI. Oh, and I didn't mention she had an upper respiratory infection, so we gave ciprofloxacin for that as well. I think I just jumped into talking about the COPD without mentioning she had a respiratory infection, which probably aggravated the COPD. Generally, most of the patients that come in are for reviews of blood work. That's why I would love to go in and like see a new patient and get their whole history and find out why they came in and everything like that, but we don't get to see the new patients. And I don't think he has a lot of new patients, to be honest. It's a lot of people he's dealt with for quite some time, and they're just coming in to refill medications or review lab work. This last patient, drug seeking for sure. She's faking it. She might have a little bit of pain, but the exaggeration of how she was going on, I don't believe it, to be honest. 51-year-old woman came in because she fell 2 months ago. She has lower back pain. She kept pointing at where the pain was. By the way, lower back pain is the #1 reason people come see the doctor. And I don't know how many of them are real. This was a Spanish-speaking patient. Yesterday we were at the Hialeah office. Yesterday for me was Monday. I think you guys will be seeing this on Wednesday. So she was speaking majority of Spanish, so I couldn't understand a lot of what she was saying, but I knew she was asking for drugs. What we ended up giving her was an injection of ketorolac? How do you say that? Ketorolac and cyanocobalamin, which is a B12 shot. She didn't seem to get relieved by getting the shot, by the way. I think she like wanted some stuff and we didn't give that to her, so she was pretty upset by that. I'm sorry I don't really have much to talk about this woman besides the medication we gave her. A lot of the conversation was in Spanish, so I couldn't really keep up. My Spanish is very basic, and when medical terms in Spanish start to come up, it's pretty hard for me to keep up. But that's it, guys. Those are all... Did I talk about that? Yeah, those are all the patients that I saw yesterday. Let me know if you guys have any questions. I'll see you guys next time. Remember to like and subscribe, comment, and share.